How does a DATscan help in diagnosing Parkinson's disease? Imagine trying to solve a puzzle where some pieces are missing. That's similar to diagnosing Parkinson's disease, especially when symptoms are unclear. A DATscan is a special imaging test that helps fill in some of those missing pieces by showing how well the brain's dopamine system is working. It's particularly useful when doctors aren't sure if the movement problems are caused by Parkinson's or something else. Parkinson's disease happens when nerve cells in a part of the brain called the striatum start to die. These cells produce dopamine, a chemical that helps control movement. The nerve cells have tiny structures called dopamine transporters that regulate dopamine levels. When these cells die, fewer transporters are available. The DATscan uses a radioactive tracer called ioflupane I-123 that specifically binds to these transporters. If there are fewer transporters, the tracer binds less, and this difference shows up on the scan. The scan itself is done using a technique called single photon emission computed tomography, or SPECT. It creates detailed images of the brain, highlighting areas with healthy or reduced dopamine transporter activity. If the scan shows decreased activity, it suggests that dopamine-producing neurons are lost, which supports a diagnosis of Parkinson's disease. If the scan appears normal, it makes Parkinson's less likely, but it doesn't rule out other conditions. It's important to remember that a DATscan isn't a definitive test on its own. Doctors relying on a combination of clinical evaluation, medical history, and other tests. The scan is most helpful when symptoms are mild, atypical, or confusing. For example, if someone has a tremor but it's not clear if it's Parkinson's or another movement disorder, the scan can help clarify the diagnosis. However, the DATscan has some limitations. It can't distinguish Parkinson's from other disorders that also involve dopamine loss, like certain atypical Parkinsonian syndromes. Factors such as age or medications can influence the results. Plus, the scan shows dopamine transporter activity but doesn't measure how severe the disease is or how fast it's progressing. In summary, a DATscan helps diagnose Parkinson's disease by providing visual evidence of dopamine transporter loss in the brain. It supports the clinical findings and can improve diagnostic confidence, especially in tricky cases. Still, it's just one piece of the puzzle, and healthcare professionals consider many factors before making a diagnosis. If you or someone you know is experiencing symptoms, it's always best to consult a healthcare provider for a thorough evaluation and personalized advice.